and the onset of action happens after 1 to 2 hours after the first dose, and slightly earlier, maybe 30 minutes after omeprazole. Yep. So these drugs are formulated in a way to be released in the duodenum because those are alkaline basic drugs that needs to be absorbed lower than the stomach, in a pH which is higher than 7. Yeah. So in order to have the proton pump inhibitors well absorbed, we need to delay their absorption lower down until they reach the lower down into the duodenum and the jejunum, lower down into the intestine, not at the stomach level. However, there is an acid-resistant enteric coat. Sometimes they can add it, acid-resistant enteric coat, to protect them from premature degradation by gastric acid. Okay, and also there is an oral product which contain omeprazole combined with sodium bicarb, and we know that sodium bicarb is an acid-reducing agent. So this can reduce the acidity or neutralize the acidity of the stomach, and can make the absorption faster at the level of the stomach also by adding this sodium bicarb. Um, yep, yeah, the use of injectable proton pump inhibitors is specifically used for critically ill patients, especially those who are suffering from acute stress ulcer. We mean by stress ulcer here is the physical stress, not the psychological stress. Yeah, for critically ill patients who can suffer from stress ulcer, like those who are having renal failure, like those who are under burn patients. Okay, so those cannot use drugs orally, and they need the injectable proton pump inhibitors. So, what are the indications for proton pump inhibitors? Number one, erosive esophagitis. Okay, as we have mentioned, gastroesophageal reflux disease can lead to erosion of the lower esophagus. So, if this complication has happened from gastroesophageal reflux disease, the proton pump inhibitors are the drugs of choice. Active renal ulcer and those gastric ulcer. Also, for the treatment of hypersecretory condition like Zollinger-Ellison syndrome. It is one of the components for successful eradication of H. pylori because it improves the penetration of the antibiotics that is used for the eradication into the parietal cells of the stomach. So improvement of the penetration, improvement of the bioavailability of those antibiotics inside the parietal cells is the main mechanism for which uh, the proton pump inhibitors are added. That's why they are added to the eradication therapy. Um, the adverse effects, they can cause nausea, they can cause diarrhea, they can cause headache. Okay, they can cause GI disturbances in general, some abdominal pain. Okay, but all these are usually well tolerated side effects, and there are some concerns about long-term use. Long-term use can lead to bone fracture because it can reduce calcium absorption. It can reduce calcium absorption, especially for the elderly patients. Yeah. Okay. So, what are the drug interactions that we know a little bit about the proton pump inhibitors? Proton pump inhibitors at the level of the liver, at the hepatic level, it can block the metabolism of warfarin, phenytoin, diazepam, and cyclosporin. Therefore, these drugs, plasma concentration of these drugs can be significantly elevated and increased, and therefore their action can be also exaggerated. Okay, their effect can be exaggerated. Therefore, if we want to use proton pump inhibitor along with warfarin or phenytoin or any other drugs, it has we have to uh, take precaution by reducing by reducing the dose of each of these drugs that are taken concomitantly at the same time with proton pump inhibitors. Okay, by blocking the hepatic enzyme, those proton pump inhibitors, especially omeprazole, can reduce the effectiveness of the antiplatelet clopidogrel. Okay, because they are inhibitors of the enzyme cytochrome P2C19, and by this, the clopidogrel cannot be converted into the active metabolite. Clopidogrel is given as a prodrug, inactive, inactive precursor, prodrug. So once it reaches the liver, it becomes active by this enzyme, which is usually sometimes inhibited by omeprazole. So omeprazole can lead to inactivation or to block the activation of clopidogrel. Also, the suppression of gastric acid by proton pump inhibitors or even H2 receptor antagonist can lower down the vitamin B12 absorption. So it can lead to vitamin B12 deficiency anemia. Can lead to vitamin B12 deficiency anemia. And because the proper absorption of vitamin B12 requires acid level enough or sufficient amount of acid in the stomach to be absorbed. Yep. Also, calcium carbonate, as I mentioned before, the absorption of calcium carbonate is impeded or it is disturbed by the elevation or by the elevation of gastric pH as a result of the use of proton pump inhibitors, reduced gastric acid production, and elevation of gastric pH. This will reduce the absorption of calcium carbonate, so therefore, calcium citrate should be substituted in these cases. In cases where proton pump inhibitors are used, calcium citrate is unaffected by gastric pH for the sake of its absorption, while calcium carbonate is affected significantly by increasing the gastric pH when the proton pump inhibitors are used concomitantly. The second group, the H2 receptor antagonists, they differ by from the first group, the proton pump inhibitors, and they are less efficacious. Okay, they are they are specifically important in reducing the nocturnal, the nighttime gastric acid production. Okay, so for those who have nighttime GERD or nighttime hyperacidity or nighttime heartburn, especially when they sleep at night, okay, the H2 receptor antagonists can benefit them because they are potent for this, if especially for this purpose, for the reduction of nocturnal acid secretion. Yeah, they differ from the first group. They differ from the first group. Are we still sharing? Yeah. They differ from the first group by being reversible inhibitors of their receptor, while the proton pump inhibitors are irreversible inhibitors of the enzyme hydrogen potassium ATPase. Okay, um, and they are selective. Those drugs are selectively acting on histamine 2 receptors. They do not affect the allergic receptor H1. Huh? So H1 receptor is the allergic receptor that is widely distributed elsewhere in the body, while H2 receptors is specifically distributed on the stomach and on the blood vessels. So that's why this selective action will lead to less effect on the other histamine receptors. The names under the H2 receptor antagonist are cimetidine, ranitidine, famotidine, and nizatidine. Okay, all these are they have the same efficacy. The maximal effect is the same. The difference is in the potency, okay, in the dose that can produce 50% of the required response or the required effect. 50% of the required effect is different in the dose of these drugs. So, for example, for ranitidine, it is 5 to 10 times more potent than cimetidine. Means the dose that is required to produce 50% is less for ranitidine and cimetidine by 5 to 10 times. Um, the problem is always with cimetidine, because cimetidine is a number one, is an significant hepatic enzyme inhibitor. So whenever we use cimetidine, we expect all the drugs that are taken concomitantly at the same time their serum concentration to become increased, because cimetidine inhibits their metabolism, like warfarin, diazepam, phenytoin, all the list that you can see here. Yep. The other important problem, disadvantage of cimetidine is that it can really easily penetrate the CSF. Okay, and therefore in high doses it can lead to confusion. It can lead to dizziness. It can lead to hallucination. Yeah, it can lead to CNS side effects. Yeah, and cimetidine also can have anti-androgenic side effects. Anti-androgenic side effects. So cimetidine here, as you can see, it can have anti-androgenic side effects leading to gynecomastia, enlargement of male breast, and also galactorrhea and reduced spermatic count. So all these makes cimetidine less preferred to be used than the other drugs, which include ranitidine, famotidine, and nizatidine. The indications for the treatment is almost the same. It's almost the same as the proton pump inhibitors, except that the proton pump inhibitors are more efficacious, and therefore they are considered as the drugs of first choice. Drugs of first choice for the treatment of peptic ulcer, both gastric and duodenal, acute stress ulcer when it is given intravenously. Yeah. For treatment of GERD, also the proton pump inhibitors are considered as superior to the H2 receptor antagonists. Antimuscarinic agent, as I mentioned to you before, they are less commonly used, less prescribed. Therefore, some of the textbooks now are not including the antimuscarinic agents. Not including the antimuscarinic agents. Who's waiting? NG. So recently they are removed from the treatment of peptic ulcer because of their limitations and because of their lower efficacy as compared to the others. So we have the next group is the mucosal protective agents or the mucosal coating agents, which includes two names. We have sucralfate and we have colloidal bismuth. So for sucralfate,